Suddenly you turn the TV and on screen. Children in hospital beds, doctors in protective masks, news headlines about outbreaks, red rash spreading across skin, a disease so contagious that one infected child can infect up to 18 others, a disease that once killed millions of children every year, a disease the world believed it had almost defeated. Yet today, it is coming back. In schools, in hospitals, in entire communities. Across the world, from America to Europe, Asia to Africa, measles cases are rising again. Health experts are calling it the comeback of a forgotten killer. And the most frightening part? This disease was already preventable. So why is measles returning? What are the warning signs parents must never ignore? And how can a simple vaccine stop a disease that spreads faster than almost any virus known to medicine? Tonight, we uncover the truth behind the global measles surge. What is measles? Measles is a highly contagious viral disease caused by the measles virus, a member of the paramyxovirus family. It spreads through coughing, sneezing, breathing infected air. The virus can stay in the air for up to 2 hours after an infected person leaves the room, meaning someone can become infected just by entering the same space later. That's why measles spreads incredibly fast. Before vaccines existed, nearly every child on Earth got measles. Even today, it remains a major cause of illness and death in children worldwide. The history of measles and vaccine development. Measles has existed for more than 1,000 years. The first detailed description of the disease was written by the Persian physician Muhammad ibn Zakaria al-Razi in the 9th century. For centuries, measles outbreaks killed millions of children around the world. Before vaccines were developed, almost every child became infected before the age of 15. In the 1950s, scientists finally isolated the measles virus. One of the key researchers was John Enders, often called the father of modern vaccines. In 1963, the first measles vaccine was introduced in the United States. Later, scientists developed the combined MMR vaccine, which protects against measles, mumps, and rubella. After global vaccination campaigns led by organizations such as the World Health Organization and UNICEF, measles deaths dropped dramatically. By the early 2000s, many countries believed measles might soon be eliminated. But recent outbreaks show the fight is not over. The global measles surge. For decades, vaccination campaigns dramatically reduced measles. Between 2000 and 2024, measles deaths dropped by nearly 88% worldwide. But something alarming has happened. Cases are rising again. In some countries, measles cases are now the highest in decades. In the United States alone, more than 1,100 cases were reported in 2026, most linked to outbreaks. Across the world, outbreaks have been reported in over 100 countries. Experts warn that measles resurgence is a global public health warning sign. Because measles spreads so easily, even small drops in vaccination can cause outbreaks. Why measles is so contagious? Measles has an extremely high R0, that is basic reproduction number. R0 is number of people infected by one person. For measles, R0 equal to 12 to 18. Compare that with COVID-19, 2 to 5. Flu, 1 to 2. This means measles is one of the most contagious diseases in human history. If an unvaccinated person is exposed, 90% chance of infection. The story of a measles outbreak. Let's imagine a real-world scenario. A child returns from international travel carrying measles. The child has mild fever and cough. Parents think it's just a cold. 2 days later, the child goes to school. Within a week, 10 students infected. Teachers infected. Families infected. Soon the outbreak spreads to the community. This is exactly how many outbreaks start. In fact, one outbreak in the United States began with a traveler entering a community with low vaccination rates. Why measles is increasing again? Experts say multiple factors are responsible. 1. Decline in vaccination coverage. To stop measles transmission, 95% of people must be vaccinated. but global coverage has dropped to about 84% for the first dose, far below the herd immunity threshold. Measles and rubella partnership. This leaves millions of children unprotected. 2. COVID-19 disrupted vaccination programs. During the pandemic, vaccination clinics closed, health systems overwhelmed, parents avoided hospitals, millions of children missed routine vaccines. History of vaccines. Those children are now vulnerable. 3. Vaccine misinformation. Social media misinformation has created fear about vaccines. Some parents now delay or refuse vaccination. But scientific evidence shows the measles vaccine is safe and extremely effective. 4. International travel. Air travel allows viruses to move across continents in hours. A single infected traveler can trigger outbreaks. 5. Clusters of unvaccinated communities. Outbreaks often occur in groups where vaccination rates are low. Once measles enters these communities, it spreads rapidly. Real measles outbreak stories. To understand how dangerous measles can be, consider a real-world scenario. In 2019, a large outbreak occurred in New York City, where hundreds of children became infected after the virus entered a community with low vaccination coverage. Health officials from the Centers for Disease Control and Prevention had to launch an emergency response that included mass vaccination campaigns, school exclusions for unvaccinated children, public health warnings. Hospitals saw children with severe complications such as pneumonia and dehydration. Similar outbreaks have occurred in countries like United Kingdom, India, and Pakistan, showing that measles can return quickly when vaccination rates fall. These outbreaks prove that measles is always waiting for an opportunity to spread. How measles spreads. Transmission occurs through respiratory droplets, airborne virus particles, direct contact with secretions. An infected person becomes contagious 4 days before the rash appears. This makes measles extremely dangerous because people spread it before they know they are sick. Measles symptoms. Symptoms appear about 7-14 days after infection. The disease progresses in stages. Stage 1. Early symptoms. High fever, cough, runny nose, red watery eyes. These symptoms resemble the flu. Stage 2. Koplik spots. Tiny white spots inside the mouth. These are a classic sign of measles. Stage 3. Rash. A red rash appears, starting on the face, spreading down the body. The rash lasts about 5-6 days. Measles typically causes high fever with rash, cough, and red eyes. Dangerous warning signs. Some patients develop severe complications. Parents should seek urgent medical care if a child develops difficulty breathing, severe dehydration, persistent vomiting, seizures, confusion, extreme weakness. These signs may indicate life-threatening complications. Complications of measles. Measles is not just a rash. It can damage multiple organs. Serious complications include pneumonia, the most common cause of measles death, encephalitis, brain inflammation that can cause seizures, brain damage, death, blindness. Vitamin A deficiency during measles can damage the eyes. Severe diarrhea and dehydration. Subacute sclerosing panencephalitis, a rare but fatal brain disease occurring years later. Who is most at risk? High-risk groups include children under 5, malnourished children, pregnant women, immunocompromised patients, unvaccinated individuals. Investigations. Doctors diagnose measles using 1. Clinical examination. Typical symptoms: fever, rash, cough, red eyes. 2. Blood test. Detects measles IgM antibodies. 3. PCR testing. Detects measles virus genetic material. 4. Epidemiological history. Recent travel or exposure to infected individuals. Treatment of measles. There is no specific antiviral cure. Treatment focuses on supportive care. Supportive treatment includes hydration, fever control, oxygen if needed. Treatment of bacterial infections. Supportive care and fluid replacement are key components of measles management. The role of vitamin A. Vitamin A plays an important role in treatment. The World Health Organization recommends 2 doses of vitamin A for children with measles. Vitamin A helps reduce complications, protect vision, lower mortality. Typical dosage in less than 6 months is 50,000 IU. From 6 to 11 months is 100,000 IU. Larger than 12 months is 200,000 IU for 2 days. However, vitamin A does not prevent infection. Vaccination does. How measles is prevented. The most effective prevention is vaccination. The MMR vaccine protects against measles, mumps, rubella. 2 doses provide about 97% protection. Future risks and global preparedness. Public health experts warn that measles could become much more dangerous in the future if vaccination coverage continues to decline. Organizations such as the World Health Organization and Centers for Disease Control and Prevention emphasize 3 critical strategies to stop the surge. 1. Improve vaccination coverage. Every country must reach at least 95% vaccination to maintain herd immunity. 2. Strengthen disease surveillance. Early detection of outbreaks allows health authorities to act quickly. 3. Combat vaccine misinformation. Public education is essential to rebuild trust in vaccines. Experts warn that measles is often the first sign of weakening health systems. If the world fails to control it, other preventable diseases may also return. But with strong vaccination programs and global cooperation, measles could still become the next disease eliminated from the planet. Global vaccination strategy. To eliminate measles, countries aim for 95% vaccination coverage. When vaccination rates drop, outbreaks appear. Measles acts like a warning signal for weaknesses in health systems. Why measles is a warning sign. Public health experts call measles the canary in the coal mine. When measles appears, it means vaccination programs are failing. Healthcare access is weakening. Communities are becoming vulnerable. The future. The world stands at a crossroads. If vaccination increases, measles could be eliminated globally. But if vaccination declines, outbreaks will grow larger. And children will continue to suffer from a disease that should no longer exist. Measles is not just a childhood rash. It is a disease that can cause brain damage, blindness, death. Yet it is also one of the most preventable diseases in medicine. The solution is simple. Vaccination. Imagine a world where no child dies from measles. A world where a simple vaccine protects millions. That world is possible. But only if we choose science. Only if we choose prevention. And only if we protect the next generation. If this video helped you understand the danger of measles, please like the video, share it with parents and families. Subscribe for more life-saving health knowledge. Because one video could save a life.